is an American community. As in most towns, people go about their daily activities with a feeling of confidence. Confidence in their businesses. Confidence in their schools. A confidence in the general well-being and health of their city. But is all this confidence justified? Can you be sure that this water is free from contamination? How do you know that this milk carries no typhoid or undulant fever? Can you assume that this animal is free of rabies? Can you feel confident that this food has been prepared and served under sanitary conditions? Well, of course, our health department protects us from dangers such as these. But does it? Many Americans live in communities whose health departments are neither properly equipped nor staffed to do an adequate job. And too many of us live in areas where there is no full-time public health service at all. You may feel that your home is safe. You've taken every precaution to keep your family well. But you don't live in isolation. A neighbor stricken by an infection can suddenly be a menace to your family's health. Unsanitary handling of the milk you drink can jeopardize your life and hundreds of others. Careless disposal of garbage, polluted stream, an unsprayed breeding place for mosquitoes can bring disease and death into your home no matter what precautions you take. Your health is tied up with the health of the entire community. And the best protection for everyone's health, well-functioning community health program. Let's see what kind of a job could be done in a community by a full-time health department cooperating with local physicians and voluntary health agencies. You'll find that the health department takes an interest in you from the very start. First, you are identified as an individual with your very own footprints. A report goes to the Division of Vital Statistics. Your certificate of birth is secured, and the world learns that it has a new citizen. By keeping records of all births, deaths, and important diseases, Vital Statistics keeps its finger on the health pulse of the community. It is here that the first signs of an epidemic can be spotted and countered in time. Your health department thinks about you even before you come into the world. In prenatal clinics such as this one, mothers-to-be are taught how to care for themselves and how to prepare for actual birth. What an expectant mother eats has a great effect upon the health of the infant developing within her. So a nutritionist from the health department helps the mothers plan a diet which is nourishing, well-balanced, and economical at the same time. After the baby has been taken home, in many communities, a public health nurse visits to offer some helpful suggestions on infant care. Mother is usually anxious to show that she has had everything all ready for the baby's arrival. But there are some things that mother is eager to learn, like how to bathe the newcomer. Well, youngster, you're the actress in this scene, so come on. The main point of the nurse's visit is to teach mother how to help herself, to give her self-confidence. The nurse establishes a friendly, easygoing relationship with mother right from the start. The sureness with which she handles the infant impresses the mother. This is an opportunity for mother to ask questions about infant care, about feeding, and other problems. Throughout the visit, the nurse carefully sizes up the baby's physical condition and behavior so that she may detect early signs of illness or disorder. In such cases, she recommends immediate attention by the family physician in order to avoid any complications that may later arise. A careful record is kept of each visit. As an ambassador of good health, the nurse instills the feeling that the mother is not alone in her efforts to safeguard the health of the baby. A good health department also provides child health conferences where mothers may take their children for monthly examinations. The job of these well child clinics is not to treat sick children, but to keep youngsters well by giving timely inoculations and regular checkups in order to reveal defects at their earliest stages. While mothers wait to have their children examined, health department nutritionists talk with them. Special feeding problems are often discussed at conferences such as this one. Children need regular checkups right through school. A good school health program sees to it that all defects found in examination are corrected by either a private physician or a health clinic. Such a program is most successful when it is run cooperatively by the school, the health department, and the local medical and dental societies. One of the most important jobs of a health department is to control communicable diseases. At this community-supported tuberculosis clinic, chest x-rays are offered all citizens. A mobile x-ray laboratory on wheels, frequently co-sponsored by local voluntary organizations, takes this vital service to industrial plants and remote sections of the community. Work such as this has helped cut TB death rates more than 90% in the past half-century. Venereal disease, too, is being brought under control. Cases are tracked down to prevent spread of the disease, and free clinical examinations and treatment are offered in confidential surroundings. Records of those undergoing treatment are known only by the clinic staff. Thousands of dollars worth of livestock are lost each year because of rabies, not to mention the menace to human beings. To help combat this threat to animal and man, voluntary neighborhood clinics for inoculation of pets are conveniently set up for the protection of the entire community. Though the private physician can do much to help protect your family's health, he needs an organized health department back of him to combat the health hazards of our environment. For instance, it is the job of the department to see that food in restaurants is prepared under sanitary conditions. The health department sanitarian is as scientific and keen as Sherlock Holmes. He is the consumer's FBI man, foe of bacterial invasion. How clean are these glasses? How hot is the scalding tank? How well is the food being refrigerated? The patrons of this cafeteria can rest assured that the food they eat is safe and wholesome. The soda fountain, too, gets a once-over from the sanitarian. And sanitary cups are a further protection against bacterial contamination. Milk is one of the most nutritious foods which man consumes, but if not properly safeguarded, it can be the carrier of many diseases. Under unsanitary conditions such as these, the milk cannot help but become contaminated by dust, flies, and filth. Due to the vigorous efforts of health department officials, raw milk retailing practices have been virtually eliminated in most communities, and experience shows that farmers in the long run benefit financially by adopting sanitary methods. Milk and milk products should be pasteurized. Every step from milking to bottling should be done under the most sanitary conditions. Here, under the watchful eye of the sanitarian, the teacups have been dipped in a chlorine solution and attached to udders, which have also been washed with a chlorine solution to protect against contamination. The milk cans and other utensils must be properly cleaned and stored. Pasteurization machines give us further assurance that our milk will be safe. Even after the milk has been packaged and is on its way to the consumer, a public health inspector checks its temperature and collects samples for laboratory analysis. These are the results of tests with 2 samples. A high bacterial growth here indicates unsafe milk, while this sample shows milk which is safe to drink. The sanitarian looks after your health at every stage of milk production and covers every type of milk product as well. With these precautions, you can be sure that the milk you drink is safe. But what about the water you drink? In rural areas, sanitary engineers supervise the installation of wells to make sure they come up to standard and are not likely to become contaminated. Sometimes this means eliminating unsanitary privies which may menace the water supply. Farmers find that installation of properly constructed sewage disposal units saves them money in the long run, not to mention the health protection it affords their families. Those of us who live in cities have less direct control over our water supply. We depend upon purifying plants to keep our water cleansed of harmful material. In this plant, a sample of water is taken every 15 minutes of the day and night for chemical analysis so that it may be checked for impurities. Twice a month, samples are sent to the city or state health department laboratory for further examination. At the laboratory, many types of specimens are received daily, not only from health department officials, but from private physicians and hospitals too. A staff of skilled technicians conducts microscopic examinations and numerous other tests in their relentless search for diseased organisms. Here, a bacteriologist, pipetting extract of beef heart into a blood sample, will show at the end of her daily run which of the specimens show evidence of syphilis. The tube on the left is positive. Such findings are quickly relayed back to the physician or person requesting the service. Public health laboratories have proven themselves indispensable in protecting the health of the community. With communicable diseases on the decline, attention today is being turned to the increasing problem of chronic diseases. Cancer, which continues to take a tremendous toll among older people, is diagnosed in modern clinics, often sponsored by voluntary agencies. For children who have been physically handicapped by polio, club feet, palsy, and other crippling maladies, many communities operate rehabilitation centers supported by public funds and voluntary agencies. Here they are given medical care, training, appliances, and braces necessary for their recovery. The youngsters' education proceeds uninterrupted while convalescing, so that they may return to society better adjusted to normal living. This is a sign of progress, a sign which points to a new, broad avenue. Not many years ago, these parents who have brought their children to this mental health center might have felt they had nowhere to turn. Their boys and girls have behavior problems. But today, in many communities, parents, teachers, and doctors can call on health department or privately supported clinics where the staff are trained to understand why children act as they do and to deal with underlying causes of behavior. For example, the psychologist here observes Mary in a playroom where she feels free to do things she's not allowed to do anywhere else, but which are meaningful to the psychologist. Meanwhile, the psychiatrist listens to the mother's side of the story. Play therapy helps tell the psychologist what is behind a child's behavior. For instance, finger painting can be a delightful way for a little girl to let go when mother is too fussy about neatness at home. An adolescent considered a failure at home can express herself creatively through metal tapping and go away feeling better able to cope with her world. A mental health clinic also helps parents and schools discover what children can do best through special psychological tests. Here, a grade schooler reveals her ability to coordinate hands and eyes. And even a baby's intelligence can be determined at an early age. Think what this knowledge can mean to parents who are worried about a child's development. Think what all these services of a mental health center can mean to a community. Industrial areas present another challenge to the community health program. Public health officials regularly inspect factories to try to eliminate hazards which would otherwise cause crippling accidents. In this work, they receive wholehearted cooperation from plant managers who realize that safety keeps workers on the job and results in greater productivity. In the coming years, more and more attention will be given to problems and diseases of the aged, for here is an increasing segment of our population. At counseling centers run by community health agencies, their problems are analyzed and a program of activity is developed. In an effort to prevent illness, medical care and health lectures are frequently given. Somehow you don't become as depressed with your problems when you understand them and can discuss them with others. A program of arts and crafts, sponsored by a local social welfare agency, serves to keep minds active. A man whose skills are no longer accepted in the commercial world finds fulfillment in learning a new and useful occupation under sympathetic guidance. At recreational centers, old folks can again gain the peace and joy which comes from liking and being liked. To do a real job, a community health program needs the interest and help of a lot of people. So health educators, upon request, visit schools, clubs, churches, and other groups to assist in their health promotion efforts. Educational materials such as booklets and films are provided without charge. With the active cooperation of local newspapers, radio, and TV stations, the health message is brought before the public effectively. You have seen some of the ways a well-functioning community health program operates. Are you receiving this health protection in your community? Many communities are not. Is it fair for you and your family to be without the best health services available? This problem concerns every citizen. It concerns you, your neighbors, the teacher, the private physician, the dentist, the school principal. What can you do about it? Well, before you go off the deep end, better get all the facts. Find out what health services, if any, are available in your area. Then compare these with health services enjoyed by other communities. If you find great differences, then you ought to get together with other interested people in your community to discuss the problem. Invite representatives of local organizations which may already be working for better health services, the local health officer, members of the medical society, voluntary health agencies, and other community groups. From this meeting may develop the beginnings of a community health council, a group which will set out to find the answers. Often the first job of the council is to determine the community's major health needs. Are old-type unsanitary privies still being widely used? Is unpasteurized milk still causing undulant fever among the people? Are careless, disease-breeding garbage disposal methods still in use? Is your local health department unable to cope with these problems because of a lack of funds and workers? These or other conditions may exist in your community. Once your council has the facts, your community is well on its way to better health services. For you'll find that the people and their public servants are rarely, if ever, opposed to improving local health services, if only they can clearly see the need. The job will not be easy, but it can and should be done. Your State Department of Health will be glad to help you in your efforts. When your community is aroused to its health needs, you should take specific steps to improve the situation. You can see to it that old, unsanitary milk handling is replaced by clean, carefully inspected milk production. Old, disease-inviting sewage disposal methods replaced by sanitary methods which are best suited to your area. Disease-bearing parasites barred from access to homes by effective rat-proofing methods. Careless garbage disposal practices replaced by sanitary methods at home. And a sanitary landfill for city garbage disposal to deprive marauding rats and flies of a primary source of nourishment in existence. And most of all, a fully staffed, fully equipped local health department to look after your vital needs. The job never ends. As our communities grow, our health needs change and increase. With the rapid growth in population, the dangers of disease and injury become greater. Overcrowding often results in a breakdown of health standards until conditions like these develop. It is to the interest of all in the community that housing like this be condemned and eliminated, and that new and better homes be built in well-planned communities. A dynamic community health program, physicians, voluntary agencies, and the health department working together can do much to ensure your well-being and that of your children. It can provide the kind of environment which is essential to good health and wholesome living. But a modern full-time health department cannot exist without active citizen support. It's up to you.